Rod Davey, carrying on that theme of Toronto Western surgeons and medical professionals going elsewhere. Rod, who's a wonderful person, heads the orthopedic division, demonstrated not only here but also in Guatemala his surgical expertise and his big heart going to Guatemala to perform the operation that he does, total hips and total knees on patients who needed that surgery and didn't have access to it in Guatemala. Now, one of the things talking about 2008 at the Toronto Western Hospital that we will literally remember forever, especially Dr. Catherine Zahn, who told us about 5 years ago, this was UHN's #1 priority, was the transformation of critical care at this hospital. And we can now truly say that our patients in the critical care area, thanks to Loretta and Ted's generosity, are being treated with high touch as well as high tech. We've always had great critical care practitioners, ICU doctors and nurses and physiotherapists at the Toronto Western Hospital, but they've simply been working in substandard space, developed, designed, built in the 60s, and of course critical care, as you know from watching television, has advanced dramatically since the 60s. Especially those patients who come here for special treatments, neurosurgical treatments for example, we simply have to provide them the same kind of world-class critical care that we're providing them with in the operating room. And we're now able to do that. Here are some photos of the critical care areas that were recently opened. We've celebrated the phase 1 of the opening of the critical care areas. We started off looking like this. Here is examples of our own critical care unit. You can see they're dark, low-hanging spaces, and crucially, separated patient rooms separated by curtains. Basically one big bullpen just separated by curtains. And of course, patients in critical care are extraordinarily sensitive to infection. The worst thing possible is to have patients where infection can simply spread around the curtains, through the curtains, one patient to another. This was outmoded treatment, and we're so happy to be able to celebrate the opening of the critical care area that separates our patients in single rooms, appropriate airflow to these rooms, where nurses can actually look after one patient at a time as they should be looking after, and where we can allow patients to receive appropriate supports by developing the kinds of rooms they need while their loved ones are in the critical care area. This is an $18 million capital project that we budgeted $7.5 million in private funding required. Loretta, as a director of the Toronto General Western Foundation, took up championship of that need. And boy, that's quite a way to champion it, Loretta, to cover off 2/3 of the need in one single swoop. Thank you so much. You're simply amazing. We told Loretta she's not quite off the hook yet. There's still a little bit more to be done in that area, but thank you so much for championing this. And for us to say thank you is one thing, for the staff to say after leaving. Those people working in that critical care area are so excited. The opening occurred in August. 2 additional phases to come online. We're so proud to be able to treat patients in this wonderful setting. Some more pictures that show the high-tech booms that actually suspend monitors and administration devices over patients and allow nurses free access, physicians and allied health workers free access to the patient within a single room setting. And again, you can see the kind of lovely patient-centered waiting areas that we've been able to develop for families for some of the most stressful moments of their lives while their loved ones are in the critical care area. So it's a wonderful facility. Now, going back to your issue of translation, sir, we've shown you the best treatment available anywhere in the world for our patients today. What I want to spend just a little bit of time talking about now, my last few minutes, what's on the horizon. What do we see as challenges, and what do we see as treatments? And I think we all recognize, I certainly recognize when I get up in the morning, that we're all aging. The baby boom population is getting creaky joints, getting bifocals, and you know, we don't remember quite as well as we used to. Those chronic diseases, aging of the brain, forgetfulness, blindness, arthritis, those are the challenges that remain. We spend a lot of money on heart disease, a lot of money on cancer, curing brain degeneration, arthritis, blindness. That's what the future is, and those are the things that we're investing in at Toronto Western Hospital. Degenerative diseases of the brain, Parkinson's disease, Alzheimer's, degenerative diseases causing blindness, macular degeneration, glaucoma, cataracts, and degenerative diseases of the joints. These are the areas that we focus on clinically today. These are the areas that we pledge to cure in the future. And I want to tell you a little bit about how we're going to do that. Toronto Western Research Institute, led by Dr. Peter St. George Hislop under the direction of Chris Page, is one of the world's leading centers in looking at degenerative diseases of the aging. 133 researchers, 105,000 square feet of what we're going to show you currently, an adequate research space, an awful lot of money, $26 million of peer-reviewed funding, a terrific facility with world-class, world-leading people that simply is housed in an inadequate setting. Lots of good stuff happening in brain imaging, behavior, fundamental neurobiology, discovering how neurons, how brain cells link together, what happens to them in disease. Lots of patient-based clinical research, vision science, arthritis research, all these things happening in these areas of degenerative disease. Lots of papers. I'll just skip over this by telling you that the Toronto Western Hospital publishes papers at the equivalent of Massachusetts General Hospital, hospitals like UCLA, San Francisco. We produce science at the same level as those hospitals that are internationally renowned. We also have renowned leadership. Dr. Peter St. George Hislop, who's the director of the Toronto Western Research Institute, and also at the University of Toronto, director for the Center for Research in Neurodegenerative Diseases, was one of 4 scientists recognized by Dalton McGuinty with the inaugural Summit Awards given to Ontario scientists who have an international impact. And certainly, Peter St. George Hislop is probably the world's premier neuroscientist. We're so proud to have him here as our leader. Now, I mentioned that we've got great people, but there's no question they don't have the facilities they need. Basically, our scientists currently are working in converted inpatient units built in the 1960s to manage patients, not to provide scientific laboratories. But due to an extraordinarily generous gift by Bob Kremble, we can now see the dream of being the world center for degenerative diseases in brain, joints, blindness becoming a reality in the Kremble Discovery Tower. This is what it looks like. We're well on our way to fundraising for a new science tower that will cover along Leonard Street, and turn 90 degrees and come along Nassau Street. This is an extraordinary building that gives us the opportunity to provide our world-leading scientists with world-leading facilities. Now, how often is it that you have a dream and in the space of a year, that dream becomes a reality? Well, that's what's happened at the Toronto Western this past year. Due to Bob's generosity and Jerry Halbert's extraordinary hard work, along with Tony and Leo and so many people that have worked in helping us, we've raised the funds, almost completed raising the funds necessary for the outer core of the building. And thanks to that $119 million grant from the federal government, we're well on our way to fitting out now about 2/3 of the laboratory and equipment needs that that building has. So we're about, I think it's fair to say, Jerry, probably about 60 to 70% of the way there. Maybe, Jerry would let me say 50 to 60 maybe. We've still got a way to go is what you'd like me to say. We've still got a way to go. But in the space of a year, due to inspired philanthropy and inspired leadership, this dream has become a reality. We think that the Toronto Western campus is going to be the neuroscience, degenerative arthritis, and blindness center, not forgetting Don's generous gift, which will help us fit out this Donald K. Johnson Center within the Kremble Tower. It's simply extraordinary. So, sir, that's what translational research is about. It's about providing the best answers today, but always looking forward to how we provide cures to our patients in the future. Thank you so much for your attention.